All right, so this is going to be a chest pain. So kind of describe your signs and symptoms along those lines. If you don't know what to answer, I'll answer for you. So I'm going to do the full from the C incisor to the end of the secondary. And so first thing is penment. So personal partner patient safety. I should have my eye protection on. I don't, but I've got my gloves on. We'll just say I have my eye protection on. Making sure the environment's safe. I have no environmental hazards. Number of patients, I see one. I'm looking to see if I have more than one. I don't. This is chest pain, so it's an NOI, but I'm not going to rule out MOI. I've got ALS on the way. No need for SMR, no need for extrication, and no need for additional BSI due to gross blood loss. My general impression is a male in his 30s who's sitting high fallers in the chair in no apparent distress at this time. He has A on the AFPU. I'm going to introduce myself. I'm an exam paramedic. Can I help you out?
Hi, my name's Brett. Yeah, I have some chest pains, a little bit of difficulty breathing.
Okay. So he's already elicited his chief complaint. I didn't have to ask. He gave it to me, and sometimes patients will do that. So he's got chest pain with shortness of breath. Which one came on first, sir? Chest pain or the shortness of breath?
The chest pain.
So I'm going to have my professional partner put on a pulse ox, and then we'll determine whether or not we're going to give him oxygen. But since I don't have that, I'm going to put him on a nasal cannula at 6 liters at this time, just to see if that helps us out. What's your name?
Brett?
Where are you, Brett?
I'm sitting in a classroom.
Okay, and is it morning, noon, or night?
It's morning.
Okay, and how old are you, Brett?
38.
So it's A&O times 3, that's LA County. And what led up to this?
I was studying for a test.
So it's A&O times 4 for National Registry. So his airway is patent, I can tell that. His breathing, I'm looking at rate, it looks like it's between 12 and 20, so it's not too fast or too slow. Rhythm is a regular pattern, there's no irregularity. Quality is unlabored. And then depth is good tidal volume from what I can see. It's not too shallow, not too deep. I'm gonna go ahead and listen to your lungs, sir. And at this time I would expose his chest. I'm not gonna do that for our purposes of this video. And then I would look for deformities and disabilities, see if there's any decap BTLS. So take a deep breath for me. Side by side comparison. You're a very good patient. Can you lean forward for me? I don't have to go that far forward. Sure. Act it out more. Settle. Fall on the floor. All right, lungs are clear and equal bilaterally with good tidal volume. Circulation, I checked his pulse and it was strong and regular. Skins are normal, warm, and dry to the touch. So I'm looking for temperature, moisture, and color of the skin. So again, it's normal color, warm, and dry to the touch. I don't need to do a cap refill because I did a quick pulse check. And I checked for deformities, disabilities, I exposed. So my formulation is, with his chief complaint of chest pain with some shortness of breath, he's a high priority, is what I'm thinking. Code 3, if I'm BLS, to the most accessible receiving. If I got ALS on board, then I'm thinking a STEMI and then assisting ALS, but we're not at that phase yet. So at this time, I'm gonna have my professional partner get me a blood pressure, a pulse, a respiratory rate, a pulse ox. I've got my skin signs. I don't need to do a pupil check because I don't think there's anything neurological going on with this guy. So I'm gonna start with my OPQRST sample. So what were you doing when this started again? You were just...
I was just sitting in a classroom studying for a test.
Okay, and did it come on suddenly or?
Yeah,
Kinda
pretty
slowly?
suddenly. You know, I'm a little stressed for the test, so I thought it was anxiety at first.
Has it been a constant pain?
Yes, it's kind of a throbbing a little bit.
Okay, has it been getting worse?
Yes.
Does anything make it better?
No,
Is the oxygen helping at all yet?
a little bit.
Does anything make it worse?
No.
With one finger, can you point to where the pain is?
It's kind of a crushing, but I kind of feel it here.
So in the center of your chest?
Yeah, just,
Does it move anywhere?
no, it's not really.
Okay, so initially you said throbbing, but you say it's kind of a crushing?
I mean, I could feel my heartbeat, but it does feel like it's something's pressing on it.
And on a scale of 1 to 10, before we got here, when it started, 10 being the worst pain you've ever felt, 1 being the least, how would you have ranked it before we got here?
Before, I'd say about a 7.
You said the oxygen's helping a little bit. What would you rank it now?
About a 5.
That's good. And it started how long ago?
About 20 minutes ago.
It got 25 after, so 11:05.
I'm looking for JVD. I'm gonna go ahead and fill his leg spreading pedal edema.
Sir, this is just a check we do for when we're checking someone for a possible complaint of cardiac issues going on.
Okay.
While we're listening to his lungs. Do you have any nausea or vomiting?
I feel a little sick, but I haven't thrown up or anything.
Okay, so a little nausea?
A little nausea.
Any weakness or dizziness?
Little weakness. No dizziness.
How about lightheadedness?
No.
You did say you had associated shortness of breath. I'm going to do a little check here on your chest. So tell me if it gets any worse when I push down.
Yeah, a little more uncomfortable. It doesn't hurt more, just.
I want you to take a deep breath and tell me if that makes it feel worse.
No, it's just, it still feels a little crushing and tight though. It doesn't make it worse.
Are you allergic to any medications?
Just penicillin.
You haven't taken any penicillin or anything?
No.
Okay. Are you prescribed any medications?
No.
No nitroglycerin, aspirin, anything?
I mean, I take aspirin sometimes, but not prescribed.
Did you take any today?
No.
Is there anything over the counter you take? Any herbal remedies?
No.
Any energy drinks that you drank or anything that could have, or like pre-workout that could have led to this?
I did have I had a coffee this morning.
Is that an espresso or just a regular coffee?
Espresso. Needed caffeine.
Double?
It was a double.
Not a quadruple. Allergic to penicillin. Any medical issues that you've been diagnosed with?
No.
No heart disease, stroke, diabetes, high blood pressure, seizures, anything like that?
Nothing that I've
you
been
can think of?
diagnosed with, no.
Okay. What was the last thing you ate and when?
Breakfast about, I'd say 3 hours ago.
And anything else you can think of, just wrapping up, that could have led up to this other than the fact that you were studying and you're anxious about this test that you're going to take?
No, it's the first time it's ever happened.
So you've never had an episode like this before?
No, this is different.
Okay. So we're going to continue transport code 3 to the closest hospital. Unless we got a medic on board, then we can go to the STEMI Center, unless the STEMI Center is the closest hospital. And I'm going to reassess his airway, breathing, circulation, his pain level every 5 minutes. He doesn't take nitro or aspirin. I mean, he said he does take an aspirin every now and then. Is it baby aspirin, sir? Or
No,
is
I take it for
regular?
pain.
Oh, you take it for pain. Okay. So we don't have any baby aspirin, so there's nothing that I could administer to him other than O2. If his pain gets worse, I can bump him up to non-rebreather, but otherwise we'll keep him on that nasal cannula and see if he gets any worse. All right, that's it.